I'm a medical doctor, Dato Suriyakhatun. I have been practicing medicine. Ungraduated lah, macam start kerja tahun 81 houseman kan dekat HKL. I was working as a medical doctor lah, GP from 1985 sampai 2009. Then I was in Supagene University. They called me to start a homeopathy program there. That was in 2009. I stayed there for 3 years. My contract. After the contract, I worked for another 2 years dekat private place in Tapak, that area. And after that, I buka sendiri lah.
Assalamualaikum, Doctor. So what makes you start your own practice?
So when I came here, the name that I coined homeopathy integrasi tu, because means to say homeopathy as my, apa orang kata, as the basic. Tetapi integrasi means I integrate it with whatever I can integrate it with to achieve better results. So with that, I integrate scans. For example, we have the alpha site scan, which is a thermometry scan. Dia exactly doesn't tell us sakit apa, but it tells us which region of the body is having a problem and what it could be due to.
What is your health approach and what are the type of services that you offer here?
The main one, what we offer here is a homeopathic consultation and homeopathic treatment. Okay, along with that, usually I will give nutritional advice and also supplements, or even if I do not prescribe the supplements, I will give suggestions of where to get the supplements. Okay, so that's the main thing of what I do. But in many cases, I send them for screening. So the screening is the second thing. Either they will do the alpha site, ataupun they will do the bioresonance screenings, ataupun I also send them for blood investigations. Because obviously, when a patient comes in with this symptom and that symptom, you got to know what's happening. So once I figured out what's happening, then I will send them for various treatments lah. Some whether it might be just homeopathic, or maybe frequency treatment, or biofield tuning, and of course the nutritional side. So this is the main bulk of what we do. Of course, when need arises, I send them to other specialists. For example, if the patient has cancer, and we found out that, okay, this person is having this, I will write a referral and ask them to go.
So does homeopathy actually complement with current health practices?
It is already complementary to other treatments. For example, homeopathy can help a person recover from surgery and can mitigate the side effects of chemotherapy. Homeopathy does not interfere with mainstream medicine. It doesn't disturb, it doesn't compete with, it doesn't interfere, it doesn't enhance, it only complements. There is research into it. Positive research that shows that giving homeopathy along with chemotherapy drugs mitigate the side effects and make the chemotherapy more bearable, and the outcome is better.
Oh, what makes you want to incorporate DNA testing as part of your services?
So when I first accepted to do the DNA test, I actually was, rowing my little ship in uncharted waters. So we didn't really know how we are going to actually use that information to integrate it again with my homeopathy and other things. But I just had a rough idea of where I wanted to go with that. So I had a rough idea of where I was going with that, but I didn't exactly know because there was no precedent. So probably I'm the first one to do it. Yeah. So what I do know that is that we homeopaths, we frequently treat genetic illnesses. For example, we know that there's very strong family history of cancer in that family. Before the cancer actually comes, we already started the patient on treatment to prevent it. Because you know that if, for example, in my family, 12 times more possible to get cancer, than other people who do not have a family history, because my family history is from both sides, from my dad's side and from my mother's side. So we are carrying the cancer DNA, right? So how do we mitigate it? So I have studied, and I have studied the remedies that are going to prevent cancer.
May I know how you package DNA testing with your current services in homeopathy integrasi?
So when we got our patients, I think we've got more than 30 right now, then we give three things. Okay, so we give the DNA, we have the DNA, then we have the report in our hands, and then I ask them to do a bioresonance scan, and then we also have a homeopathic consultation. So in the DNA, you know that personality type is also there, and then we also have the diseases that are there, and what else do we have? We have dia punya nutrition and all that. So So what happens is that when we do the bioresonance scan, it will correlate because it will show us the deficiencies. So okay, I've got one patient who is also a medical doctor, and she did a DNA test, and I saw that she can easily contract TB. So I told her, please do not work in the infectious department. Please just go and work in the non-infectious, go and become a pathologist or something. And she comes back and tells me, no, it's okay. It's already happened. I have latent TB. So it was just confirming that, yes, she can easily catch.
Now, doctor, can you share some of your experiences consulting with your clients who had done DNA testing?
When it comes to the personality types, we have ADHD and anxiety, cannot be alone and things like that. In homeopathy, for example, there are some remedies. For example, Arsenicum album. This remedy, they can't be alone. They cannot be alone. They cannot be alone in the house. If they are alone in the room, it's fine because they know there are people outside. So this remedy will help that. So yes, so when we find that they have a DNA trait whereby they cannot be alone, I can mitigate that by giving them the homeopathic remedy that will help them not to feel alone and lonely. You're in a supermarket all by yourself, picking out things, and then suddenly you have a deep sense of loneliness. You know, it's not made up. It really happens. And so you feel as though there's nobody in the world who's with you. So when I saw this DNA trait, I said, okay, I know where that's coming from. So you can see that the DNA test will help me to understand my patient better, because by understanding the patient, where they're coming from, their genetic background and all that, it's going to help me to help them to overcome their possible, the possible holes in the ground that they can fall into. So if you do the genetic test, but there's nothing, you don't know what to do after that, it's like seeing a hole right in front of you and walking straight into it. So
you're providing...
Yeah, I'm providing the tools to help you not fall into that hole, even though you've seen it right in front of you.
Genetic.
Yeah, from the genetic testing.
Okay, doctor, final question. Would DNA testing be beneficial to children as well?
Of course, if you're doing it for children, you can actually direct them into the right direction in terms of what they're good at. My daughter Aimi, she did a test and she found out that she has got linguistic ability. I said, I already know you have a linguistic ability. I also have it. So it's kind of like confidence level boosted, So now she started looking at the children. Say, I must do for my children. I want to see which one of them are musical, which one of them are linguistic. So she can direct them into the right direction in their career as children. Because you have more scope to intervene and push them into the right direction. And with the epigenetics, when you find out that your little girl cannot stand to be alone, there's a lot that you can do to actually change the course of your keturunan, your future generation, so that the choices of the DNA that's going to come down in the future generation will be much, much improved.